Everybody, this is Missy Berry from Dedicated Home Health, and I'm going to go over a few things with you guys regarding your infection control and COVID-19 in service training module that you guys have online. So let me share my screen with everybody and we'll get started. So when you log on to the training module online, it looks like this. See the heading at the top. Then down here, we have a couple of handouts along with some policy. And there's a few key things that I wanted to point out on those things. So the first thing we're going to talk about is this handout right here that you can see on my screen. So this is the handout that goes along with this training module. So basically what this says is that we have a couple of different ways that we go about in our agency to prevent infection. And that's our primary goal, is to prevent infection. Also, if an infection is identified, we want to make sure that we are treating it accordingly, that we are notifying the appropriate people, that we are starting the appropriate treatments as ordered by the physician. So these are a few of the things that we're going to cover today. Okay, so the goal of our policy is to reduce the risk and transmission of healthcare associated infections or infections known as nosocomial infections. Now, once a patient is out of a facility for 48 hours, that infection is known as a nosocomial infection. So we also have the duty to prevent those as well. So some key things that we're going to be doing to prevent that you guys should be doing in your day-to-day practice here at Dedicated is that you're going to follow our hand hygiene procedure and standard precautions and utilize the appropriate PPE to decrease those risks of acquisition and transmission of infection. So we have a hand hygiene policy, standard precautions, which includes our bag technique, and we have PPE that we provide to you guys that's here in our closet that you guys can come get at any time should you need it. So please make sure that you're doing all of those things. We're going to go over those specific policies here in just a minute. We also want to make sure that we're providing education to all of our patients and their family about ways to reduce and prevent infection. So we have teaching that's in all of the home folders that you guys can use. So make sure that you are providing that instruction and education as well as documenting that in all of your notes, because if you didn't document it, it didn't happen. Okay, I'm going to go over the policy and procedure, some specific things with you guys, specifically here in just a minute. And make sure that you're also nurses or people that do plans of care, make sure that you are adding those interventions and goals to your appropriate plans of care about measures to reduce infection. Identifying infection risk and adding interventions to reduce infection is a standard of care and part of the conditions of participation. But those are always something that surveyors look at when they come in and review charts and do visits is, are we following our infection control policy and procedure? Are we identifying risk? Are we implementing measures on the plan of care to prevent that? So make sure that you're understanding that and doing those things as well. So ways to reduce infections. If you do identify an infection, make sure that you are reporting it to the physician or provider in a timely manner. So don't wait till the following week when you're doing your note if you're behind on notes. Make sure that you're making that phone call, doing a calm note, having it sent the same day if you don't do your own vaccine. So if you do suspect a patient has an infection, you have the duty to report it to the physician or provider. Make sure that you are completing an infection log through our Access software. Make sure that you are doing the appropriate follow-up on that. So you don't just say, oh, the patient has a UTI, here's an infection log, submit. You save it, and then you come back and you document the appropriate follow-up and then submit it when the form is complete. We do track infections quarterly on our OBQI to see if we can identify any trends or anything that's going on that would maybe something that we're doing or not doing as an agency to prevent the transmission of infections. We also try to prevent infections with vaccinations. We do have a yearly flu vaccine push that we do, encouraging you guys to get your flu vaccines as well. The COVID-19 vaccine, if you partake that, we certainly encourage you to get that as well. We have standards in place and procedures in place for hand hygiene and proper bag technique and the cleaning of equipment that we are doing accordingly. All right, so that's that handout there. Let's go over here and look at a couple of specific policies that I want to point out to you guys. Actually, I think I had it on the right one. Okay, so the first one I want to go over and talk about with you guys is our hand hygiene policy. This is, of course, very timely right now because we are in our survey window, but it's something that we should be practicing religiously on a day-to-day basis, survey window or no survey window. So our policy, you can see here, is 3 pages, okay? So there's a couple different ways that you can clean your hands, okay? You can use the good old-fashioned soap and water method if you're in the patient's home and they have a clean place and supplies for you to do that. Or the most common way that most of you are probably doing is you're using an alcohol-based rub or hand sanitizer. We do provide that for you guys. I have a whole case of it here. There's no excuse for you not to have hand hygiene. It's free. We have all of it that you could ever want. So make sure that you're keeping that on hand and in your bag, okay? So if you're using a hand hygiene based rub, make sure that you are using it rubbing it till it's completely dry into your hands. Should take about 20 seconds. It actually says that specifically in our policy. So when a surveyor comes, they're going to pull our policy, read it, and then watch it visits to make sure that you guys are following that policy. So you should be cleaning your hands one palm at a time, rubbing it for 20 seconds till both hands are dry. Okay. Prior to entering your supply bag, immediately before touching your patient, before performing any aseptic task like placing a Foley or indwelling device or handling invasive medical devices, after contact with body fluids or excretions, mucous membranes, non-intact skin, and wound dressing, and use supplies if the hands are not visibly soiled, and before moving from a contaminated body site to a clean body site during patient or client care. A contaminated body site is considered anything below the waist. So if you are doing physical therapy and you touch a patient's ankle, and then you, with that same hand, touch the patient's arm, that's considered a violation of our policy, and we'll get a ding for that. You should have used hand sanitizer when you're moving from a dirty to a clean part of the body. Okay, after touching a patient or client in their immediate environment, after contact with blood or body fluids or contaminated surfaces, and after removing gloves, okay? So anytime that, get a call, so I'll call right back. Anytime that you are, before you're going into your bag, after touching a contaminated part of the body, anytime you're done with patient care, if your hands are visibly soiled, you should obviously use them then and before and after glove use. So just remember those things. If when in doubt, use hand sanitizer and you're going to be right on that. So that's our hand hygiene policy. That is policy IC.15. Make sure that you're reviewing that and make sure that you are aware of that and following that, especially if a surveyor is going with you. But of course, we want you guys to do that all the time anyway to prevent infection to our patients and to you guys as well. So let's go over cleaning and management of your supplies and equipment, okay? Actually, I want to do bag technique first because that ties into cleaning equipment. So bag technique is going to be policy IC.60, and you guys have it in that attachment of policies for us there. Let's go down and look at it. Okay, there it is on your screen. Okay, so it's 2 pages. And so it talks about the purpose of it and then the procedure for nursing bag or therapy bag. So make sure you read over that. But this section 2 is what I really want to go over with you guys. So your bag is to be placed on a clean surface in your car. And so the surveyor that was here last year interpreted that to mean something with a barrier. The seat or floorboard just by itself is not considered a clean surface. So it can be the same trash bag that's been in there for the last year, but it just cannot be on the upholstery, okay, or the leather. So make sure that you've got it setting on something, either a trash bag that's laid out or maybe like a tub lid or something that's there for you to have a barrier in between your bag and the upholstery or leather or carpet, okay? When you go into a patient's home, you have to put your bag on some sort of barrier, okay, under the bag. You should never, 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 never place your bag on just a bare floor. Okay, so we provide a box of trash bags for you here. I know most of you have the big box from Sam's that we provided. Some of you haven't ever come pictures up. So if you haven't, you need to come get it. Otherwise, you need to provide your own. Okay, so make sure that you are using a barrier in between your bag. You can never just set it on a chair, set it on the couch, never set it on the floor. Okay, prior to the provision of care, you should use either hand sanitizer or to wash your hands. Necessary supplies may be left at the sink for hand washing at the end of the visit if applicable if you're having to use your sink to wash your hands. Okay, after cleansing, the supplies or equipment needed for the visit are removed from the bag. Then you can do whatever your visit is required. Make sure you're putting things on the barrier. You can't just take your blood pressure equipment out, your thermometer out, and lay it on the table. Those things have to also go on a barrier. The trash bags that we provided for you guys from Sam's are big enough that you could use your bag for one side and use also that's the other side to put your stuff on. Okay. When your visit is complete, okay, this is the part about cleaning your equipment that you need to look at, that you need to also clean your equipment and allow it to dry before you put it back in the bag. Okay. So that was something that we did get a ding on our last survey, because we have to follow the manufacturer's suggestion on how to use our equipment. And so how to clean our equipment with the cleaning stuff that we provide you guys. And that also says that you should allow it to dry. So let's just say that you put your barrier down, you put your bag down, you use the corner of your barrier for your stethoscope, your blood pressure cuff, whatever it is you're using. At the end of your visit, before it goes back in your bag, make sure that you're cleaning it really well with either, with most of the time use a wipe, you can use a spray, but you have to let it dry before it goes back in your bag. So if you do vital signs at the beginning of the visit, it's a good habit to get into of just cleaning them right away so they can sit there and dry during your visit and then putting them away at the end. So make sure that you are using a barrier and you're not just laying your stuff down on the patient's couch, table, wherever it is, bed, wherever it is that you guys are. Okay, so make sure that you are keeping up with a good supply of the sanitizer wipes that we provide for you guys, as well as the spray so that you can clean your things. Okay, moving right along, I want to look at policy IC.25, and so this is applicable to everybody that's listening to this in service, because everybody at one point in this agency has probably changed or taken off an Aquacel dressing. Okay, so this is how we dispose of dressings. Okay, you're going to remove that old dressing following standard precautions. You're going to discard the soiled or old dressing and the gloves that you use to take it off in a plastic bag. Then you're going to double bag that in the patient's trash container. Okay, so you don't have to use a second grocery sack. Okay, so let's just say you're taking off an Aquacel. You are going to put your gloves on, wash your hands, put your gloves on, take that Aquacel off, and then put it in, like, say, a Walmart sack or a second trash bag that you've pulled out from your box. Okay, so you're going to take your gloves off, put it in that, and tie it up. You can put it in the patient's trash if the patient's trash has a trash bag in it. Okay, that's considered the second bag. That's the double bag. You don't have to put it in a second trash bag and then put it in their trash can. Now, if their trash can doesn't have a bag in it, then you would have to use a second trash bag. But you are just going to put it in a bag, like, say, a Walmart sack or another trash bag that you pull out of your box, and then put it in their trash with a bag. And that's considered double bagging. We also do have a biohazard disposal here if you ever need to dispose of anything like that. So you need to also teach your patients, if they are doing their own dressing changes, then they should be disposing of those things as well. Okay, nurses, make sure that you are looking at IC.30, the blood collection policy, as well as IC.35 and IC.40. Those are very important, especially if you have to do blood collection ever with a visitor or a surveyor. Okay, so this is real important that you read through these. Make sure that you are using barriers for your supplies in the home. Make sure that you are using appropriately labeled lab bags, that you are transporting equipment in the appropriate labeled hard container with a lid that has a biohazard sticker. We supplied those for you guys when you first came on. If you need another one, you have to let me know. And then those things have to go into a blood cooler for transport. Okay, so make sure that you are reading through those three policies that are here at the end. Once again, that's IC30, IC35, and IC40. It's your responsibility to make sure that you understand those. If you have questions about those, certainly come see me. Okay, going on down, I've also added for you guys our actual infection control program for you guys to read through. It's pretty boring. Just skim through it. I'm responsible for doing most of that. And then make sure that you take the time to read the basics of COVID-19, about COVID-19. That's from the CDC website. So make sure that you're reviewing that, because we are still dealing with COVID-19 in the year 2024, about to be 2025. So make sure you're doing that. Here are these policies and procedures that I have gone over with you in this video for your review. And then this is the really important part, that you click this link here to sign in to get credit for this training. So if you guys have any questions of any kind, please feel free to contact me at the office or to come by. If you need any PPE, hand sanitizer, trash bags, anything you need, we provide that for you guys. So please swing by and get it. So thank you for your time and you guys have a great day.